Is Marjorie Taff. I am a registered respiratory therapist and the product specialist for Southmedic Inc. Today, I am presenting the OxyMask family of products. The OxyMask is definitely not your ordinary oxygen delivery device. The OxyMask's unique technology enables delivery of the full range of oxygen therapy, replacing the need to use multiple traditional masks. The clinical practice guidelines of the American Association of Respiratory Care states, in order to deliver 24 to 80% oxygen therapy, you will require up to 4 different oxygen delivery devices. The OxyMask's one mask system is able to deliver 24 to 90% oxygen therapy. Using one mask, the OxyMask will eliminate the need to use multiple oxygen delivery devices in order to achieve effective therapy. What is even more impressive about the OxyMask's unprecedented FiO2 range is the fact that this mask is able to do so through an open mask system. You're probably wondering, how is this possible? The OxyMask uses a unique diffuser and pin assembly technology. The diffuser is the triangle-shaped cup found in the middle of the mask that is engineered to direct gas flow toward the mouth and the nose. Inside that diffuser is a mushroom-shaped pin. As the flow of oxygen enters the mask through the rear of the diffuser, some of this flow travels up the side of the mushroom-shaped pin and curls under it, creating a series of vortices within the triangle-shaped cup or diffuser. Since this is a dynamic process, as fresh gas enters the mask, more and more vortices with accumulated oxygen molecules occur, creating an atmosphere of negative pressure, oxygen-rich velocity vortices. These negative pressure, oxygen-rich velocity vortices are then directed towards the mouth and nose by the precision angling of the diffuser. It is this combination of the accumulation of oxygen molecules within the velocity vortex, directional flow, and patient's inspiratory effort that generates the highest FiO2 range and enables the OxyMask to deliver higher FiO2s at lower flow rates, breath to breath, when compared to traditional masks. What are some of the logical advantages of using the OxyMask open mask oxygen system? We now have the ability to deliver 24 to 90% oxygen therapy while using only one oxygen mask instead of multiple devices. Titrating the FiO2 has been simplified. Adjustments are made at the flow meter by simply increasing or decreasing the flow while maintaining optimal saturation reading. The entire flow rate range can be accommodated from 1 liter to 15 liters per minute, and if necessary, as high as flush. There is zero probability of carbon dioxide retention at flow rates of less than 4 liters per minute due to the mask's wide open design. There is zero probability of positive pressure buildup in the mask, intrinsic PEEP, at flow rates greater than 15 liters per minute. No other mask allows for open communication. This mask is designed for mouth and nose breathers. The OxyMask facilitates oral or nasal suctioning as well as oral care while being worn. It is convenient and comfortable when a nasal gastric tube is involved. The OxyMask does not inhibit the delivery of other respiratory therapies, such as aerosol therapy via a mouthpiece, incentive spirometry, and airway lung clearance therapy. The star lumen tubing is attached to a convenient swivel adapter which decreases the tension on the mask and allows for positioning of the tubing. There is an endotracheal tube adapter for short-term T-piece trials. The open system allows the delivery of nutrition without disturbing oxygen therapy. These are just a few advantages that make the OxyMask the mask of choice and the new gold standard for hospitals around the world. Adding to the many logical advantages, there are several administrative reasons why the OxyMask is clearly the mask of choice and a true common sense device. As a risk management tool, the OxyMask significantly decreases the probability of aspiration, thereby decreasing the risk of aspiration pneumonia. It also decreases the probability of carbon dioxide retention and rebreathing. It eliminates the delivery of intrinsic PEEP and reduces clinical errors that occur as the result of multiple device usage. As previously mentioned, the OxyMask one mask system reduces the number of oxygen devices used on a patient, which in turn simplifies and reduces inventory. It improves time management among the clinical staff, enabling more focused clinical care rather than equipment management. It also facilitates one mask policy. Environmentally friendly, the OxyMask enables fewer oxygen delivery devices to be used per patient. It uses less PVC in its construction than any other mask. Now you have a clear picture why the OxyMask is becoming the new standard to deliver oxygen therapy. Where can the OxyMask family of masks be used? Simply, everywhere. It is ideal for use by the emergency medical service, for conscious sedation, in the OR or emergency department, in the critical care units, on the general floors, in labor and delivery, in home care, in the endoscopy and bronchoscopy suites, in the burn centers, and in the trauma rooms. Now I would like to introduce to you the OxyMask family of products. This is the standard OxyMask that fits the average size patient, approximately 80% of the patient population. Note, the open design enables clear communication while wearing the mask. Here we have the Oxy Plus, which is 25% larger for the larger face or the man with a beard. It can also be used on patients whose mouth remain wide open when breathing. The Oxy Kid has a cute 3D penguin design. The kids prefer the open feeling, and who can resist a toy-like mask? The Oxy Kid delivers the same FiO2 range as the OxyMask, 24 to 90% oxygen, while using flow rates from 1 liter to 15 liters per minute and up to flush when indicated. The newest member to our Oxy family is the Oxy Tyke, a smaller version of our Oxy Kid for those smaller children. The Oxy Tyke has the ability to deliver therapeutic concentrations of oxygen on flow rates below 1 liter per minute. The OxyMask with ear elastics is ideal for use in the trauma room and EMS. The head and neck does not have to be manipulated to place the mask on the face. The yellow insert functions like a T-piece. If required, it can be attached to the connector of the endotracheal tube or laryngeal mask to provide oxygen to the spontaneously breathing intubated patient. Once the patient is extubated, or for non-intubated patients, the yellow insert is removed and the OxyMask is used to deliver oxygen therapy in the usual manner, one mask system. The elbow swivel allows for 360 degrees rotation of the tube, allowing it to be positioned appropriately and also minimize kinking. The star lumen tubing that is attached to the OxyMask is manufactured with a universal adapter, which can be attached directly to the threaded outlet of the flow meter, to the barbed tubing connector, or to a humidifier bottle. To complete a short online test, and for further information about our OxyMask series and the full line of innovative oxygen products manufactured by Southmedic Incorporated, please visit the website at southmedic.com or call 1-705-726-9383, and our customer service staff would be more than happy to assist you.